What does the criterion encountering a resident mean? Encountering a resident means that the student treats every nursing home resident as a valuable and unique individual. A person living with dementia still has feelings, opinions, personal preferences, and the right to be heard and treated respectfully. 1. Respectful interaction. The student should learn to greet the resident and introduce themselves. Address the resident by their preferred name. Knock and wait before entering the resident's room. Speak calmly, kindly, and respectfully. Maintain appropriate eye contact. Observe facial expressions, gestures, and tone of voice. Avoid talking over the resident or as if the resident were not present. Respect the resident's language, culture, religion, habits, and life history. 2. Communicating with a person living with dementia. The student should use short, clear, and understandable sentences. Give one instruction at a time. Allow enough time for the resident to understand and respond. Demonstrate the task if verbal guidance is insufficient. Ask permission before touching or physically guiding the resident. Pay attention to nonverbal communication. Avoid arguing, blaming, embarrassing, or constantly correcting the resident. Try to keep the situation calm and safe. For example, if the resident says, "I want to go home," the student should not immediately answer, "You cannot go home." A more respectful response would be, "You miss your home. Would you like to tell me about it?" This acknowledges the resident's feelings without arguing. 3. Supporting the right to self-determination. The student should ask for the resident's opinion. Request permission before beginning care. Explain what will be done and why. Offer a small number of suitable choices. Respect refusal and try to understand its reason. Avoid forcing, threatening, or unnecessarily restricting the resident. Ask the supervisor for help if the resident refuses care. For example, the student can ask, "Would you like to wear the blue shirt or the green shirt?" 2 clear choices are often easier for a person living with dementia than several alternatives. 4. Protecting privacy and dignity. The student should close the door or privacy curtain during care. Cover the parts of the resident's body that are not being washed. Discuss hygiene and toileting respectfully and discreetly. Avoid discussing the resident's health in corridors or where outsiders may hear. Follow confidentiality and data protection requirements. Never take or share photographs of residents without proper permission. 5. A strengths-based approach. The student should not automatically do everything for the resident. They must identify what the resident can still do independently and where assistance is required. The student should encourage the resident to participate, allow enough time for independent activity, use verbal guidance or demonstrate the activity, provide only the amount of assistance needed, consider the resident's alertness, functional ability, and safety. For example, a resident may be able to wash their face independently even if they need assistance with washing the rest of their body. 6. Responding to challenging situations. Restlessness, shouting, or refusal of care may be the resident's way of expressing a need or discomfort. The student should consider whether the cause could be pain, the need to use the toilet, hunger or thirst, tiredness, fear or embarrassment, noise or excessive stimulation, an unclear instruction, infection, or a sudden change in health. The student should remain calm, ensure safety, and ask for assistance when necessary.
The resident should not be described simply as difficult or aggressive. The student must describe what actually happened.
What should a student learn during practical training in a nursing home? 1. Daily personal care. The student should practice assisting with morning and evening routines, assisting with washing and showering, providing oral, denture, skin and foot care, assisting with dressing and undressing, assisting with toileting and changing incontinence products, repositioning and preventing pressure injuries, maintaining cleanliness, comfort, privacy and dignity. 2. Supporting functional ability. The student should learn to assess physical, psychological, cognitive and social functioning. Use a rehabilitative and ability-supporting approach. Support safe walking and transfers. Use walkers, wheelchairs, slide sheets and lifting devices after proper instruction. Identify and reduce the risk of falls. Arrange activities that match the resident's abilities and interests. 3. Nutrition and swallowing. The student should ensure a safe and upright eating position. Check the prescribed food texture and fluid consistency. Assist calmly and allow enough time for eating. Monitor food and fluid intake. Recognize signs of swallowing difficulties and aspiration risk. Stop feeding and report immediately if the resident coughs, chokes, has difficulty breathing, or cannot swallow. 4. Observing the resident's condition. The student should monitor pain and signs of discomfort, breathing and level of consciousness, temperature and signs of infection, skin condition, wounds, bruising and swelling, food and fluid intake and weight, urination and bowel movements, sleep, mood, cognition and behaviour, sudden changes from the resident's usual condition. Any important or sudden change must be reported immediately to the supervisor or nurse. 5. Hygiene, infection prevention and safety. The student should learn correct hand hygiene, appropriate use of gloves and other protective equipment, the correct order from clean tasks to contaminated tasks, safe and ergonomic working methods, safe use of assistive devices, how to summon help and act during an emergency, the principles of reporting hazards, near misses, and adverse events. 6. Medication care. The student may participate in medication care only according to their education, competence, authorization, and the nursing home's instructions. The student should understand the principles of safe medication administration, correct identification of the resident, monitoring the effects and adverse effects of medication, situations in which medication must not be administered before checking the instructions, whom to inform about an error, uncertainty, or change in the resident's condition. 7. Documentation and reporting. The student should learn to document what was observed, what the resident said, what care or intervention was provided, how the resident responded, what the outcome was, whom the change in condition was reported to. Documentation must be clear, factual, respectful, and completed without unnecessary delay. The student should not write, The resident was difficult and refused to shower. A better entry would be, the resident declined the shower and said they felt tired. The resident was allowed to rest and assistance with showering was offered again later. When is the criterion met? The criterion for encountering a resident is met when the student consistently demonstrates the following. The student encounters the resident calmly, respectfully, and as an individual. The student protects the resident's privacy, supports self-determination and remaining abilities, and adapts communication to the needs of a person living with dementia. The student recognizes possible causes of challenging situations and asks for guidance or assistance when necessary.